And many often in the last few weeks, we gathered many queries about the application process as the coming time, especially in the May 2026 Diet of Equity, will have its new shape, new structure, but the data, the informations to be submitted are almost same, but there are some few changes. And those who are not acquainted regularly with the Royal College information site, you might lose your chance of opportunity to appear the exam. For this reason, we were thinking that this information sharing will be very important for you. Okay. So with this humble introduction as today's and my personal introduction, you know, and from the institute, we like to inform you about the eligibility. Uh, First of all, eligibility, I will tell, but my understanding is whatever I was telling or we were telling, unfortunately, our candidates were very hard to understand what we like to say. So we will take little more time and for a specific area, and we will not show you too much slide today. First of all, eligibility, you just have a look. This is latest one, and this information gathered from in the last uh, August 2025 update. And these are training track and the non-training track. May I ask you, any colleague here, anyone who will be in the training track to apply? Please, can you just raise the hand and share, please? Who will be in the training track to appear in the coming exam? Any training track applicant? Just to know from you, preferably outside Bangladesh, anyone will be utilizing the training track. No one at all? Oh, that means those who will be appearing, you will be following the non-training track. That is latest update, and the point C is there. In the non-training track, in general, you have to pass minimum 5 years after your internship. Then you will be able to apply. But above a training track, a little confusing, especially in the country where trainings are not available. Anyway, if anybody individually there to ask, we will try our best to suggest you, guide you. As nobody here, we are just jumping to the next. So no age limitation is there, and the criteria are usually under modification in time. These are very new information and modified. And there is something that the already we discussed before in one session, a little rather to say detailed discussion happened. These are the specialties acceptable other than family medicine allied there. But in the criteria, if you go back, if you want to utilize the pediatrics internal medicine training, you have to go back again. Just you look at the A. A means if you have the training. And in Bangladesh, I like to say that you might not have family medicine training, but you might have medicine training. You might have pediatrics training. You can utilize it. And how in the A you see the completion of structured 2 years training course or a 2-year diploma in family medicine. This is absolutely for the family medicine. But if you go down in the B, certification of completion of an accredited 1-year training program or 1-year diploma in family medicine. So this is family medicine related plus additional 2 years clinical experience during the last 10 years. This additional 2 years clinical experience is from the allied subject. So what they are explaining, these should consist of either 2 years in family medicine or a minimum of 1 year in family medicine with a further year in specialties allied to family medicine. That means your training 1 year could be counted other than family medicine subject. So that's just to explain. I actually went back. If you come to that C, 5 year GP, so those who are a little bit seniors means you completed your internship 10 years before, 12 years before, you definitely would not have 5 years experience in the family medicine, especially country like Bangladesh. So in these 5 years, how it will be calculated? 3 years family medicine, 3 years family medicine, and other time, other years means 2 years in the allied subject. Allied subject means already, uh, I will show you again. Internal medicine, pediatrics, and other subjects. So in this track, 2 year could be counted plus 3 years should be in the family medicine. But if you don't have again, not family medicine, it is not the training. It is only you are practicing family medicine. Experience is not training, is not structured training. I think I tried my best to make you things are clear. Even if you don't understand, we can discuss later. So this is the importance of the allied subject, including emergency also, pediatrics, gynecology. And the second thing in the certification of the experience by someone, this is very critical today to understand. If you are working in a private hospital or institute, so you will take a letter from the hospital or institute. It should be done by HR department. Don't be confused that it can be done by, given by assistant professor or above consultant. Second one, if you are private personal practitioner, try to understand, personal private practitioner, these letter will be signed by assistant professor or above rank from established institute or by a senior GP. But in Bangladesh, like country Bangladesh, there is no designated person as senior GP. Officially, no designation there. So our suggestion is assistant professor and above rank, one academician will give the certificate to the private personal practitioner. I will show you a sample today also. So this is one of the sample. If your country, I'm not telling only for Bangladesh, other SAARC country or any other country in the Middle East. So if you have any senior GP post officially, for example, you see the doctor utilizing the designation as general practitioner. If it is a senior one, it definitely senior than you, senior GP. So it can be. To overcome the problem of senior GP position or other, our suggestion, especially for Bangladeshi candidate, to take the certificate from assistant professor and above. And senior GP should need further clarification. Okay, let's see. And how to prepare the institute certificate. It should be in the letterhead here. That means the name of the institute, address, and others. Then, according to the structure of a certificate, here this information would be enough. We already cross-checked that this information is enough by the Royal College. Okay. Indirectly, we have communicated that this type of certificate is okay or not. They replied okay. They replied okay. It could be your certificate just to fill up your personal data here where we have kept some blanks are there. So it is institute, remember, deputy general manager. Okay. So this is very hard, and anyone, you can raise the hand if you need to know further. Eligibility criteria for the part 2 will be after passing the part 1, immediately you can apply for the OSCE exam. Okay. We will not keep you more time today. We will be finishing within very short time. And there is no limit of
স্যার
any protocol.
মানে
Yes.
এটা কি যে কোনো ডিপার্টমেন্টের হবে না, শুধু মেডিসিনের অ্যাসিস্ট্যান্ট প্রফেসর বা
Better to be by any clinical practitioner, medicine, surgery, gynae, or other subject. Those who are practicing, those who are seeing the patient, it would be better. Though they didn't mention it, they will mention, maybe they are always under modification of the information. Suppose, for example, the HR department, they have added in the last year. It was not before. So better to avoid the confusion, better to be taken from a practitioner doctor, clinical practitioner doctor. And come to that, there is no limit of the for the part 1, but after passing the part 1, you will have three you will have 6 years time. In the 6 years, you will be given 3 attempts for OSCE exam. There is a little harder area. If you be away from your study, you might lose your chance. So within 6 years, you must pass. So when you will be preparing for the OSCE, you need to be more serious. Otherwise, you need to come back from the part 1 again. Okay. Now, how to apply very practical action plan? Just look at from onwards from the next May exam, the procedure will be online. I believe that by applying online, there will be overcoming of many hurdles happened before by the manual application. And the application, there is a sample of application already we have, but this application form may be a little bit modified in the online application. But the data, those who will be required, it could be same. We will give you a link today, after a few minutes of our YouTube link, where we described the form and how to fill up the informations. There was a live session recorded. We will give you today. Just come here after with this application form. You need to add some things, as it will be online application, not hard copy to send by the post. So there are some modification of the words are there. You just follow my talk here, that you need one medical graduation degree like MBBS degree. This is one copy. Another one, internship completion certificate. Next, photocopy of any of your valid medical license. So I think the photocopy, it is not very important word here, because you might have a scanned copy of your medical license. If it is a scanned copy is there as a photograph, you will submit it. Okay. Though they have said is a photocopy, I think it will not make more difference that you are not sending photocopy. I think it will be a printing mistake by them. Okay, if photocopy is there, it should be attested also. It is true, but you will give the direct main copy from there. If you don't have medical license in your hand, even don't have any original copy in your hand for any other reason, then you can utilize the photocopy. Okay. Evidence of your
আসসালামু আলাইকুম স্যার।
salam.
স্যার,
Yes, Dr. Tanjir,
স্যার অনলাইন কি শুরু হয়েছে নাকি স্যার বাংলাদেশ থেকে
from
এবার?
from 15 from 15 from
ও,
15
তাইলে
January.
আর এবার পাকিস্তানের করাচিতে পাঠানো লাগবে না?
This is the message we are delivering today. You just follow us until the end, then you will ask later also. Okay.
ওকে ওকে স্যার।
Until I finish the talk, you just wait. So, evidence of your eligibility to practice. This is that one. the certificate given by senior GP or assistant professor and above, that is already shown to you. One photograph, bio page of your valid passport or color scanned copy of your national ID. That means a photo ID, like your national ID, uh, this one, or a passport also. Note that online portal will accept JPEG file. Remember the word JPEG. If you have the file in the PDF format, better to convert it to JPEG. Otherwise, you will get the trouble. And e-signature. How to give the e-signature? Just asking you. Can anybody say how to give the e-signature? Dr. Javed here. Thank you, Dr. Javed, experienced colleague.
Assalamualaikum, Dr. Usman. Yes,
Assalam. How to
Usman,
give the e-significance? What is your experience?
actually, previously we applied direct, I mean, through courier, but
Yeah.
I think e-signature is by you go to the top and there is file over there. You click, this pen is over there. So when you click there, so then
Could be, could be. Yes,
at
they
the
are
base you
there.
can sign. You sign by, I think it was if you have a laptop or something, so you can sign directly over there.
But you are thinking very easily, but it is not very easy job also. How can you write by the mouse in your system?
With a finger, if your touch system with a finger,
If you
otherwise
don't have the touch system, that means you need to have any device which have the touch technology.
then
Again, touching it doesn't mean that you can sign exactly according to your national
yes,
ID
it
or
will
other.
not be exactly
There
yes.
will there will be distortion. So far in my knowledge, e-signature, you will make a signature on a paper, scan it, make a copy, and post there. Sometimes we do it in the area. It could be, but we have to wait until they give the instruction. And I'm very afraid that will they give 1 or 2 days before detailed instruction of each point? Otherwise, there will be a rush of application in the 15th. Okay, 15th January. So if you don't understand from the beginning everything, you will see the trouble there. So from before, my humble suggestion to you, get ready in many ways. What Dr. Javed said, this one could be the way. So be ready for this. Second thing, just your official signature, write somewhere, make the signature, make a photograph, and preserve the photograph so that after scanning, this signature containing piece of the paper, rather to say, you can put there if they allow in this way. So I hope all of the points you understood here. Now, when the date of the exam, this is again updated. I will show you the later one we collected before. This is the 15th January. Okay. And the application so and so. But why I put there to remind you, the second slide, it was collected earlier. 12th January was the time of registration opening. They have updated it. But I don't know. Did they give any extra notification in the website? I'm very sorry to say. I didn't find it. We are regular almost to see the website. They just few days before also we were advocating or telling that 12th January, but in the meantime they have modified it. So you need to be attached, you need to be up to date with the informations. We are trying our best especially in the WhatsApp group, AKT WhatsApp group, is the information. So don't be confused. 15 January. And regarding the payment, what is this? In the bottom line, they have mentioned, you may not read this. They do not make fee payment when applying for the exam. Once your slot is confirmed only, then you will be advised for fee submission. So you don't need to send the record of payment, other thing at the time of application, because your submission of your application doesn't mean confirmation. You need to wait. But again, as a preparation, you need to be aware of transaction of the money. How will you transfer money to, especially if you have to send money to the Pakistan, For example, like any other country, you need to face some hassles. So get ready. Okay. So anyway, this is a this the actually this is a obsolete copy of today. This slide 12 January, not 12 January. And other date actually I don't like to mention. It will be up to date, and we are giving the slide in the group also. And they receive only TT, telegraphic transfer. You see, in pounds or US dollar. Okay, not by other currencies. Possibly they were receiving, Dr. Javed, I think you can say because you are experienced, they were receiving Pakistani rupees, is it?
Yes, actually, in Pakistan, I asked them. It was written on the website, pound,
Yes.
dollar. But when I asked them, they said you can deposit in rupees
No,
also.
no, that was mentioned also before, the Pakistani rupees.
It is not
Somewhere,
mentioned.
possibly. But this
But
is
in
very,
Pakistan,
very update.
from outside, I think you have to go by the
Pound
pounds.
or dollar, yes, better. From Pakistan could be possible as a local currency, but they didn't mention about the local currency. They have said, you see, any other forms of payment or payments in another currency will not be accepted. They didn't mention about that is possible in the Pakistan by local currency. Okay, because there is a reason. They are trying to develop country-wise local office. Still, it is available. Pakistan already have. They are the founder, originator. India and the Sri Lanka. Sri Lanka, I think from a few years back, recently in the India also available. They can apply there also. Indian doctor can apply there. And they didn't mention that. For example, Bangladeshi doctor cannot apply to Sri Lanka, cannot apply to India. Though it's a practical issue. If home country have the office, they will feel better. Candidate will feel better to apply to the home office. So they're trying to establish it. For this region, they make it general that Indian, Sri Lankan, or other country, Myanmar also there. Myanmar, I think you have seen in the calendar. Myanmar also now included in the South Asian International, MRCGP International exam. So this is a TT. Try to talk to your bank how you can send the TT to Pakistan from before. Otherwise, you will be in trouble later. Though immediately in the first day, you don't need to send the money. Okay. The rate will be dollar rate and the pound rate. The after the application opening date, what may be the rate of dollar and pound? It will not be actually big difference. They are telling that the rate will remain as the same till the last date of registration. Same till the last date of registration. Okay, so I better let me read. Exchange rate decided before the opening of the registration. Before opening, for example, the 15 January is the opening date. So until 14 January, what will be the rate? You can send there according to the rate. If it is by the local currency, definitely, if they accept it. But if it is by dollar and pound, already pound mentioned there, so you can send by the pound. Okay. I think it will not be difficult for you. Many of you residing in the Middle East country and other also regularly, you have the experience how to transact money. Now, where to knock them? They have segregated in the few months, actually few months before, they updated the contact informations. So if you wrongly send the mail, they will be rather bothered, disturbed. Eligibility and the general queries below. 1, 2, 3 honorable persons are there, including their the mail ID. You will send them. And finance issue, this gentleman, and this is this one. Okay. And second thing, anonymous IDs will not be responded. If you are given an ID, suppose they will give you an ID number also after application, online application. If anybody here today in my colleague, you have experience of MRCP, I think you already know about MRCP, the Royal College Communication, how to go with. So they will give you one ID. Second thing, anonymous ID. From the anonymous ID, that means the ID is not registered with them. They will not reply. So my humble suggestion for you, rather, to overcome the confusion, make ID with your name, not by ambiguous symbols. Maybe in one word or two words, make or prepare your ID with your names so that they can easily identify. They are the landlines. You may not need to talk more because in the landline, I think they have some mobile number they usually provide. Personally, you can utilize the WhatsApp, but they didn't mention any WhatsApp number here. Dr. Javed, what is your experience? Behind the screen, just
I think
asking you.
this last two numbers, the mobile numbers, they are one of them is on WhatsApp also. Zero
Last
six or 07. I don't remember the exactly. I think 06.
in
This
the
one.
last two is the mobile,
Last
right?
two. Last two. Those, that one. The
The
above one
nine
is
two above one the
words.
landline. These are the mobile cell number.
No,
Oh,
these two last two are mobile numbers,
uh,
and among the mobile number, the top one 064906
06
is
could be the
WhatsApp also.
WhatsApp number. Yes. So
If
this is
anybody
also
want to
important.
call by WhatsApp, they can respond on that.
Yes, can respond or minimum you can send a short message also.
Message also, yes, on WhatsApp message also you can send.
Yes. So my suggestion to all of you that if you need to know specifically something from them, you need to ask earlier because whenever exam date is approaching or application date is approaching, they will be more busy. Right, Dr. Javed? They will be more busy. So try
Yeah.
to know earlier whatever you need to know. Okay. So that is the main issue today for you, doctor. I don't have to say much more. I think you may have something to ask me now. And finally, this is the link we can give you in the group, WhatsApp group, that how application form is filled up. I think Dr. Javed can remember. We have actually said before to this, right? With this, how to fill up the form. Though
It's very
this form will be given in the online now, but you can get an idea by viewing this video, the how you put your data there. Almost information will be same, but you need to put online. That is the difference, technical thing. Dr. Javed, to add anything?
no, you are, mashallah, explaining very clearly.
That is the
And
thing.
the form is very simple, not big one. You
Yes,
can
yes. It is
find.
very easy. So for I don't like to take your more time today. Yeah, we'll give the links. You can go through maybe 10 or 15 minutes. We discussed only about this, just to be oriented. So that's all. And this is our the just contact detail, WhatsApp as well as the Telegram, though we are not much active. This is our WhatsApp number. And this is the exam YouTube link. I think you will get in the WhatsApp. Rather, if any new colleague today, in the chat box, I am posting this just in the chat box. You see, you just by one click, you can join there in the WhatsApp. After 5 or after finishing the session, we will give you some relevant information to you. So that's all from my side, my beloved colleague. If you have any query now about these procedures, anyone, please. Dr.
Sir, I
Jayant,
am
please. Yeah,
Ji,
Dr.
yes,
Jayant, I
sir.
remember you. Please carry on.
Yes, sir. Thank you, sir. How are you, sir?
Yeah, fine. Fine.
Okay, sir. Sir, my query is whoever having the experience of more than 5 years in only general practice, are they eligible for the exam on
Yeah.
solely general practice?
Yes, this is a very valuable experience you are having. After internship,
Okay.
after
Yes, yes,
internship, minimum
yes.
5 years. But tricky thing that if you have 15 years, 20 years after internship, there will be a trouble. Just hold 5 seconds. Okay, been back. Dr. Jayanta, please.
Yes, sir. Yes.
If you have for example, I'm telling for others, not for you, possibly, that you are very senior one, 20, 15 years over from the internship, but you are not doing any practice in the last 10 years. Actually, you cannot apply. Okay.
Okay.
Your experience should be in the last 10 years.
Okay.
Okay.
Okay, sir.
In the
I got
last
it.
10
I got
years.
it. Okay, sir.
Otherwise, you will not be eligible. Okay. No more? I hope no more. So can we conclude now for today? If you don't have any query. So from my side, thanking you. This is again inviting you to see our YouTube link. Usually we post in the group. So, and regularly it is updated in the YouTube. Many informations, learning materials, including OSCE also. Even those who are appearing MRCP, you will get many things. Hopefully it will be very useful. And we are developing our website also, where we will be very happy to introduce our updated website within few days. They will be more organized.